The fifth question, which is in front of your screen, that what is the diagnosis in a 62-year-old man with the painful, guys, mention this, all the key points: painful, red, and diffusely swollen eyelid without the pointing pustule. Please underline this, without. Now, what about the treatment of the foreign body? You want to ask about this treatment of this iron foreign body? Remove it. Remove the foreign body with 26 gauge needle. Yes, we'll take a 26 gauge needle, right? And we'll try to remove this foreign body, okay, which is available on the cornea. Yes, we'll remove this. Yes, हमको remove करना है iron, okay? So this is the treatment for it. So remove the foreign body with a 26 gauge needle. And now your question, maybe some of you can ask me, sir, why only the 26 gauge you mentioned? Please remember, it is a very fine and very thin, right? So this will be not going to create the some injuries on the cornea. So it will not make injury on cornea. Yes, so that's why हम ये fine needle को use करते हैं, which is the 26, right? I hope you know about the gauzes, right? So जितना कम gauze होगा उतना ही ज़्यादा broad उसका क्या होगा, आउटपुट होगा, राइट? यू नो अबाउट इट वेरी वेल, राइट? सो इसलिए हम बिल्कुल फाइन, जितनी पतली हमारी क्या होगी, निडल होगी, हम उससे क्या करेंगे, इसको रिमूव कर देंगे. वी आर गोइंग टू रिमूव विद दिस द थिननेस और द फाइन निडल, राइट? सो वहां पर ज्यादा इंजरी नहीं होगी. सो देयर इज अ वेरी लेस चांसेस टू क्रिएट द इंजरीज ऑन द to make or create the injuries on the cornea. So this will be going to safe side. Okay, so that's why we are using the 26 gauge needle. 26 gauge needle. I hope it is clear to you, Dr. Rahul. Right? Very good. Perfect. Right? Let's move forward for the next question. Now, reply me in the chat box. I'm waiting for your answer, guys. That the what is the diagnosis in the 62-year-old man which is having the with the painful red diffuse swollen eyelids and without the pointing pustule. So there is a no pointing pustule. They clearly mentioned you, and of course they mentioned you the all the important. They mentioned you all the options, like the A is the chalazion, B is your external hyaluronic, which is the striae, and the C is your internal hyaluronic, and D is your preseptal cellulitis. I'm waiting for your answers, guys. And the first of all, I'm creating here that it cannot be the A. Chalazion cannot be. Why chalazion cannot be? Because this chalazion is your painless condition. Yes, chalazion कैसा होता है? Painless. Yes, chalazion is totally painless. So in the clearly the MCQ mentioned that this is a painful. So chalazion cannot be possible. Of course, there is a diffuse salon eyelid and redness. It can be seen, right? It can be seen in the eyelid pain is in the eyelid. So it cannot be possible in the preseptal cellulitis also, because in the preseptal cellulitis we are going to see the whole lower eyelid, on the lower area of the infraorbital areas will be going to affected here. Now the two option which is the very confusing is here. Many of you are answering the external hyaluronic and no one answered. Yes, one of answered the about the internal hyaluronic. Now listen this part, guys. This is the answer of this question is your internal hyaluronic. Right? Now you can understand this part, why I created this all the MCQs, right? So for that you will be going to understand this level of the MCQs, right? Because everyone is answering the external hyaluronic, but no answer is your internal hyaluronic. The external hyaluronic cannot be, because in the external hyaluronic, please listen this part, in the external hyaluronic, I'm clearing you, it will be shows you, it will be going to show pointing pus sign. Yes, pointing pus sign वहां पर आपको show होगा. It means there is a pus will be going to pointing out to you in the external hyaluronic, And please remember, this is the only difference between the external and the internal hydulum. And in the internal hydulum, there is a no plus point sign. This is the one thing which from the clinical history or from the only question you can identify about the internal and external hydulum. Just listen this part. Of course, I'm going to cover up this all of the three topics. The chalazion, we'll talk about the chalazion, we'll talk about the we'll talk about the chalazion, we'll talk about the external hydulum, and we'll talk about the your internal hydulum also. हमको बात करना है all the topics. We'll talk about the all the topics है ना, हम बात करेंगे सारे topics के बारे में. Now